Gynecologic cancers or cancers of the female genital tract or reproductive tract, which includes the cervix, the vagina, the vulva, and the uterus and ovaries, is one of the most common cancers. In fact, it is the second most common cancer that occurs in women. And it is probably one of the most common causes of deaths as well. Every year, we see thousands of women who are diagnosed with gynecologic cancer. And the access to treatment is still limited in our country. So we continue to struggle trying to help these women get better after their diagnosis.
1 out of every 2 men and 1 out of every 3 women will be diagnosed with an invasive cancer in their lifetime.
3,500 of new cases are diagnosed in the Philippines every year.
And most of them are diagnosed in the late stages.
But before we look at what causes cancer, we must first understand what it means.
Cancer is basically a disease that involves the abnormal growth of cells.
These cells can then invade other parts of the body, multiply and produce new tumors.
I'm Dr. Rose Joy Vallega. I'm a gynecologic oncologist. So we have 5 main types of gynecologic cancers. Cervical cancer is the most common out of all of them. We also have uterine cancer and ovarian cancer. Not very common, but we also see vulvar and vaginal cancers.
I am Maria Judith Socorro Maldonado Gonzalez. I am 51 years old. Last 2020, I was diagnosed with the ovarian cancer, stage 4. At this age na kuya nakabatsyag, isang 50s na kuya nga, do hindi na nami ang akon nga dumi na batyagan ko nga do uncomfortable ko sa akon nga tummy. Ang akon nga pagpanginhi hindi normal. Kay ti ako health conscious man ko. Nakaon mo ko nami, wala mo ko bisyo.
Many of the gynecologic cancers, especially cancers of the cervix and the vagina, often present with vaginal bleeding or abnormal vaginal discharge. Other symptoms can also include pain, abdominal enlargement in the case of ovarian cancer. So the symptoms will depend on which organ is involved. For cervical cancer, the main cause is actually human papillomavirus infection. And we can avoid contracting this virus through safe sexual practices. Being it a virus, we have already developed a vaccine against HPV. Girls as young as 9 years old can actually get vaccinated. And screening also involves examination of the cervical cells through pap smear, and very recently we also have the human papillomavirus testing. Doing both tests will actually increase the chances of detecting abnormalities in the genital tract that may eventually lead to cancer. They can get screened as often as 2 to 5 years depending on their results and their risk factors. Together with vaccination, screening can help decrease the chances of developing these HPV-related cancers. So while it is true that women have an increased risk for cancer the older they get, we still get cancers in women who are younger. For uterine cancer, commonly exposure to estrogen, most common risk factor for developing endometrial cancer. However, exposure to environmental factors that can cause DNA damage also is a risk factor for developing uterine and ovarian cancer.
In-refer ko sa kay Dr. Vallega na OB. Pag-check niya sa akon, kinanglan, ginya i-labs ko. Dito ginakita nga may cyst nga nakita sa akon ovary. Yung operahan ko, ginkuha to, after sa to, gin-check. So, ang result ng biopsy is, positive gid na cancer ko. Dili ko gin-refer sa, sa corzonoxin, mga chemo. Pero subong tapos na, hoping maayo ko tani. Pero okay lang ako, hindi fight gyapon
Treatment of gynecologic cancers will depend on the organ that is involved. So we can do a combination of surgery, radiation, and chemotherapy depending on the organ of origin and the stage. So for cervical cancer, gold standard of treatment is actually radiation to the pelvis together with chemotherapy. Unfortunately, surgery can only be done in very, very early cases of cervical cancer. As for uterine and ovarian cancer, we can do surgery as primary treatment, and depending on the risk factors for recurrence and metastasis, we can give chemotherapy and radiotherapy depending on the case and the stage.
Sa financial support na gidya, grabe Daw free ka balahaw, daw wala gid ko yung maging gastoya. Wala gid gani sa malasakit na pala. Libre gidya. Kuan ka lang ibuligan mo, self mo ka mabulig matala sa imo. Amo lang gid na iyang imo, yung ma-offer da iya. Pero di sa financial, nami gid. Wala ko yung gambal, yung siling, yung na ginaano ko yung CL. Pero sa experience ko, yung mambal ko gidya. If guro ang pinaka-perfect, guro is 100 gidya hatag ko ang mambal ko lang sa mga staff, sa corzonoxin, keep it up. Sa nakita ko, positive kita na namin ka mo, kabay pa nga, hindi ka mo magbago. Nga, damo pag ka mo tao, mabuligan. Kay for sure, damo pag ikakinanglan sa bulig, mo. Thank you, Gid, sa tanan-tanan. Una kay Lord, pag sa inyo tanan, naging gamit.
Gynecologic cancers are actually preventable. We just need to have a regular checkup even without symptoms. We do not need to wait that we have symptoms before we go to the doctor. As we say, prevention is key. So we have screening methods that we do for cervical, vaginal, and vulvar cancers. We also offer gynecologic checkup to check for the other pelvic organs such as the uterus and the ovaries. Going to your doctor regularly for a checkup is important. CLMMRH is committed to provide quality health services to our women so that they will not develop these gynecologic cancers. And we are also committed to providing treatment for these women should they be diagnosed with gynecologic cancers.